I'm Liliana. I'm your student nurse for today, and I will be doing a head-to-toe assessment.
Okay.
Can you please tell me your name and date of birth?
Abraham Wakana, December 13th, 1994.
Good, Mr. Okana. Can you tell me what brings you here today?
General checkup.
Okay, do you know where you're at?
The hospital.
And do you know who the president is?
Joe Biden.
And do you know what year it is?
2022.
Good, so that tells me my patient's oriented ×4. And also by looking at him, I can see normal symmetry. He has good posture. Pupils are symmetry. Nothing in the face noted. His skin is intact and good color for his ethnicity. And do you have any allergies that we need to be aware of?
No allergies.
No allergies. And from a pain 0 to 10, how much in pain are you, with 10 being the worst?
0.
0. Okay. So now we're going to start the head-to-toe assessment. I'll start from your head and we'll go down. And before I start inspecting and palpating, I'll do hand hygiene. So doing hand hygiene, waiting for it to dry, and then putting my gloves on. Now that I have my gloves on, I can start my head-to-toe assessment, which I'll also let the patient know that I'm doing a head-to-toe assessment. So we will go and start with the head first. So we are inspecting first. There's nothing noted, no lesions, no wounds, no abnormalities noted. And now I'm going to go by inspecting the scalp. And once again, no abnormalities, no wounds, no lesions noted. And now we're moving to the eyes. They are, the pupils seem equal, they seem round, and they are size 4 millimeters. And now I'm going to go to the side to check his eyes. Once again, equal and round, and reacted to light. And now I want you to stare straight at this pen light, and then I'm gonna move forward to your eyes, okay? And accommodation notice bilaterally. And then now we're gonna move to the nose. If you can tilt your head a little bit so I can look in your nose. No redness, no swelling noted, septum in place. Now you can look back at me, and if you can hold one there and breathe. Good, and hold the other there and breathe. Good, so now we know that the airway is patent. And could you open your mouth for me? It's pink, moist, nothing noted, out of the ordinary, and teeth intact. And now after that, we will move to the chest. There's no dyspnea noted, respiratory rate normal, no intercostals going in, no nasal flaring, and we will now start by listening to the lungs. So if you can lift your shirt up, please. Okay, and we're going to start above the clavicles will be the first one, so please deep breath. Good. Over here. Good. And we'll be going to each opposite side to notice if we notice any abnormalities or changes on each side. Good. And we also will inspect the back. So if you can turn around, please. And if you can move up a little bit so the camera can see. Move back a little bit so I can reach you. There we go. So we're going to start up here. Good. You can turn back around. His chest sounded clear. Nothing abnormal. And now we're going to listen to the heart.
Okay. I gotta lift my shirt up.
Yeah, if you can pull up your shirt so I can listen to your heart. First, we're going to start with the diaphragm. And we're going to go start at the right side because the aortic is on the right side. And you can breathe normally. You don't have to breathe for me. I'm just listening to your heart noises.
Okay.
And then pulmonic will be on the left. And then I keep going. And then the tricuspid and the mitral. And now if you can keep your shirt up, I'm going to listen with my bell to hear any murmurs. And same placement. and we have no murmurs noted. You can lift your shirt now. No murmurs noted. Heart sounds good, and we're going to check our peripheral pulses. It's radial pulse good, pedal pulse good. And then right after the heart, we're going to start now with the stomach. And if you can lay back flat for me. I guess if you can go that way. Good.
Like this?
Yes, that's good. And I'm going to lift your shirt up, and I'm going to inspect your stomach. There's no redness, no swelling. There's no redness, no swelling. There's nothing. So I'm going to divide his tummy in 4 quadrants. And I'm going to listen in every quadrant and make sure I hear belly noises. Good. We hear noises on every end. You can lift your shirt down. And while we're here, I'm going to check for muscles. So if you can squeeze my arms. Good. And if you can kick back with your feet so I can check muscle tone. Kick for me. Good. And we're going to look at his feet to check for any peding edema. No peding edema. And then his arms as well. No peding edema noted. And that's it. That's our head to toe assessment. Thank you, Mr. O'Connor. You seem normal. You can get up now.
Thank you.